Ann, and I really like that neighborhood place. I'd been there some time back, hadn't been back, and I've been meaning to go there because I love the model. And I was talking to Christy after about that whole model that they have there and how it's structured. Really great
I
process.
know. We're working on this, um, youth outreach into the neighborhood model,
Hmm.
community organizing model. Um,
That
and it would
resiliency
be
part.
a wonderful site to set up that model within what they've already got.
Right. I'm looking at
Yeah.
Quintana, and we're looking at a elementary school there as well as we're planning out,
Mm-hmm.
and just the
Most
resiliency
people know
hub
what all goes
funding.
on in the neighborhood place. They have not just counseling programs; they have education programs for skills based things. They have teach you to be a plumber or a framer. I mean, they've got a lot of activities going on there. It really is an amazing set of programs. Family Services does an outstanding job
Hmm.
there.
Yeah,
Mm-hmm.
exactly. Yeah, I've been touting their model, and I was just happy to see it again. Been so long, it was good to see that it's been growing. But the waiting list is so discouraging. That waiting list. I mean, oh my goodness, that's everywhere. And then the funding issue. Those are the things we have in front of us.
Yeah, and I think maybe we need to. I've texted Paul. I hope he's okay. There he is. Yay, Paul. And that's what I was concerned about, right?
Hmm.
Um, that should have been up on the board too, where we need to put more effort. We need to look at the subtle things too. You know what I'm talking about? So like the waiting list
Hmm.
and the funding, to put more focus in those directions, the support directions would be really good. I mean,
Hmm.
housing, was the largest by far, right, in
Right,
the
right.
word cloud, but
Hmm.
you bringing up the whole funding and wait list, we need to be looking at those, triaging something,
Tree,
right?
Good morning,
exactly.
Paul. You made it in.
Paul, I'm trying to find your slide deck. If you have it, can you bring it up?
I will try. Of all things, uh, I need to upgrade my Zoom connection, and that's why instead of being on um, my usual camera, I've got to work off of the computer. That could be a challenge.
So, Ann, if
Let's
you want, send the slides to me and I'll show them. That works as
Yep,
well.
I'm
oh,
working on it.
okay.
Maybe some folks, while we're figuring out the technology, if there's some announcements,
Yes.
do
Put it in
that.
the chat box. In summer youth programs, in classes, in children's groups, encourage artistic bridges. And I'm glad to go to them and give an initial workshop or work with teachers. And it's tremendous. On the Charter for Compassion website, young people do art, they get their parents' permission, it is uploaded, and it can be seen around the world. We've got it up there in 131 languages. On Monday,
Wow.
JC of the Rotary is going to Ukraine. He's taken $500. He's going to be with 2,000 displaced Ukrainians. On Wednesday, our students are going to Guatemala, poor indigenous villages. They're getting young people there to do this. I'm going to be on Zoom with a wonderful young woman in Uganda in the Holy Cross Brothers schools. We've um, Patty Radel was just at our convent for morning prayer. We're next door to Inner City, and she was saying that she wanted to teach nonviolence to children this summer. And I said, this artistic bridges would be a great place to start. We are building positive relationships with children all over the world. So start it this summer. I'm happy to help your people.
Great. And I also saw that, Doug, that you put information in chat.
Yes, so tomorrow, Friday, May 10th, at St. Phillips College at 11:30, we're going to have an annual Mental Health Day Awareness Celebration. We do this every year, and this year it'll be at St. Phillips College, so we want to invite everybody to come out. It'll be a beginning at 11:30, and it'll run to like 12:30, 1 o'clock. And there'll be a resource fair with it, so that if you're looking for resources that relate to mental health, there'll be vendors there, tables there with lots of information. So we hope people will come out.
Which building
So,
on the campus, Doug?
I'm sorry, what?
Which building on the campus?
It's the Student Center building,
Okay.
and there'll be directional signage out there.
I also, by the way, Paul, Billy has your slides.
Yeah.
Oh,
So
great.
we're good there.
Sorry.
Okay.
You
But
can share.
I also want to remind everybody that the TEDx, the 18th, so would that be a week from, yeah, a week from this Saturday, we'll be doing 7 speakers on compassion. Jessica has her hand up.
It was just an announcement. You can go finish, Anne.
No,
Okay.
go ahead.
So New Creation will be hosting a symposium on end of life care and planning next Wednesday. Put the flyer there in the chat. And basically, this is a completely free, open to the public. We are
Nice.
wanting to assist our congregants, but also anyone in the community that needs assistance with end of life planning. In my line of work, death, you can't plan it. And sometimes people don't have the necessary paperwork. They don't have a will. They don't have, life insurance. It's a lot to deal with on top of the grief that ensues when you're dealing with death, or whether it's expected or unexpected. So we've got some great organizations that we're partnering with for this. They're all listed there on the flyer. And so if you want to take the flyer and pass it around, feel free. Thank you.
Thank you so much, Jessica. I'm going to hand this over to Billy. I'm on vacation and I'm trying to honor that myself. Not doing a very good job, but trying. Billy's going to host this morning, and all of us know our dear Dr. Paul Furukawa. He's going to bring our briefing across the decades and across the waters. So Billy and Paul, I'm handing it over to
Go
you.
on vacation. Go enjoy your time. You certainly deserve it. Go on.
Thank you.
Good morning, all. We heard a few announcements there. Are there any others we need to share before we start Paul's discussion? Good morning, everyone. Paul, do you want me to go ahead and share your slides? Is that the right thing?
Go ahead and show the first one, and I'll give a very brief introduction. What's complicated this morning is that instead of being able to use my usual camera, I have to use my computer, because as I logged in, I was told, hey, you've got to reapply to Zoom. So I'm doing this one through the browser. And I hope it doesn't cause any difficulties for the rest of my colleagues on the intersection. Back in December, I was reading the Express News, and there was an article under another view in the editorial section by the American Legion District 10 commander, Danny Muth. And his message, you may remember this one, the title of his message was "Be the One to Help Veterans with Their Mental Health." And basically his message was, be the one to reach out and help military veterans seek and accept mental health intervention. And what this did then was brought to mind an experience that I had many, many years ago overseas in Tehran, Iran. Uh, in fact, let me just mention the dates, and you'll say, Paul, were you sure you were alive back then? It was during 1974 and 76, and I was a very junior captain, social worker, and I had gone through basic training at Fort Sam and had an assignment at Walter Reed and was offered an opportunity to set up the social work mental health program in Tehran, Iran. And I accepted that. And this is basically the story of what went into that, but also what emerged was a real hero, rather unexpected, uh, from um, uh, from the community. And the question I have that I'd like for us to think about is whether or not we today in San Antonio have opportunities similar to that Fran Partain provided to the American military community in Tehran many, many years ago. So our learning objectives this morning is uh, taking a look at how stigmas continue to keep us from seeking help. And it's terrific that we've had every week an opportunity to hear the latest from NAMI and Bridges to Care and other programs that basically open the door to welcoming our request for help for our mental health issues. Uh, and we're going to be using the experience that I had over a 2-year period setting up the social work and mental health program in Tehran for our military. We had 2,000 uh, service members and 5,000 family members, most of whom lived in the Tehran, Iran area. And part of our objective today is to take a look at that situation and then apply what counts today in San Antonio, what's still relevant and what's new about trying to overcome the barriers to seeking help for mental illness in our families and in ourselves as well. Next slide. I just listed the various categories of the kinds of stigmas that we often face, and the levels could be from personal, for example, if one has an addiction, sometimes that's for our family a very shameful experience, and we try to hide that rather than to face it and to recognize that we need help for that. Likewise, we could belong to a cultural group, an ethnic group, a, uh, a, uh, a trade or profession that looks down on folks who are struggling with mental illness. Likewise, sometimes our workplace or even our religious congregation may not necessarily be always helpful in helping us seek help and find a neighborhood in our community like San Antonio. Uh, and fortunately, I think those of us who attend the intersection regularly uh, realize that we are welcome when we are seeking help. The next slide. The place and time then we're going to be looking at is the U.S. military community, the American military community in Iran in the mid 70s. And the situation was that the Persian Shah bought American arms and help. And so as a result, the U.S. sent a number of service members, totaling about 2,000 by the time uh, I was in there by about a year. And we had about 5,000 family members as well, and some of the services that support both service members and their families, similar to that which we have here in San Antonio. In other words, commissaries, post exchanges and clubs, and also sports areas as well. By virtue of this increase in the number of service members and family members, what had been a 10-person clinic, Air Force clinic, was upgraded to a 25-bed Army hospital. And in doing so, they realized they needed a mental health program. They looked for a number of professionals who might head that up. And as it turns out, they settled on having a social worker. And I and my late wife flew to Tehran via Germany and through Turkey. We had our car shipped also to Iran, but because of problems in the Suez, they had to go around the southern part of Africa, and we didn't get our car for many, many, many months. Next slide. Those of you may remember the Shah and the Shah Banu at the time, Shah Reza Pahlavi. And I showed you another photo here, and it's listed as University of Tehran, Iran, before the 1979 revolution. And as you can tell by a quick look, it looks like perhaps an American campus as well in terms of the way people are dressed. I had the opportunity to supervise 7 social work interns from the University of Tehran. So I did get a chance to visit the campus, and it did look like this. And it reminded me a lot of, for example, the University of Incarnate Word later on when I had a chance to spend time there. Next slide. So Tehran, to an American, when you first arrive, it looked a lot like the US in the 1970s. Now, on the left side, you see one woman who is more Western dressed, and in the background, you see 2 of the more traditional women in the chadors, which covered all except for their face. And I'd say if you went downtown to Tehran, and that's depicted in the right-hand side. It looks like downtown San Antonio during that era. You would see mainly folks dressed in Western style, and you would see a few folks who are dressed more traditionally. Next slide. There are certain things about Tehran, though, that were quite different from the US. For example, on the left side, you see a bazaar. And many of these were covered and very dark and so forth. Wonderful places to visit and to purchase things. What was a joy was the fact that the Tehran merchants expected you to try to barter with them and bargain with them to see about coming up with a price that would be mutually satisfactory. On the right side is typical downtown traffic. Now, let me give you an example of how the driving in Tehran differs from here. At least I hope it differs. Picture a neighborhood intersection with a light, and have picture 2 lanes going one way and 2 lanes going the other way. Of course, at the red light, you would have how many lanes then? You would have 2 lanes going this way, 2 lanes this way, waiting for a green light. In Tehran during that time, instead of having 2 lanes like this, you had 4 on each side. You had the 2 lanes, and then folks made 2 additional lanes on the other side of the street heading in that same direction. So you can imagine when the light turned green, the folks on the outside there who were again facing traffic had to zoom around in front to try to go ahead. This was typical intersection after intersection. And what you soon learned is how to be polite about letting people in, or, be in danger of getting sideswiped. So that was one difference that people had a challenge to get accustomed to. Let me show the next slide. In in setting up the 25-bed hospital, they really had on the records or on the books, uh, which is called TO&E, Table of let's see, Table of Organization and Equipment, room for only one social work officer, and that was me. I was a captain with a couple of years under my belt at the time. But because of the impact of folks like Fran Partain, our uh, our size one of the social work mental health services, show the next slide, within a year grew into not only my full-time job, but we had a part-time psychiatrist, we had two part-time counselors, we had an addiction NCO, a receptionist who would speak Farsi, and then a consultant, and I'll describe him in a moment. Uh, what was why we were able to do that is because while on books we didn't have all of these positions, we had plenty of money. My budget was almost unlimited. And so I don't know if how many of you have ever faced a situation like this. Most of us who work for nonprofits certainly do not. Um, Let me mention that in this list, the one consultant who made such a big difference was a fellow named Bill Huskins, who was a social worker and a Presbyterian minister who had been a missionary in Iran for about 10 years by that time. He spoke Farsi very well, and so in addition to having my usual military sponsor who had me and my late wife over for dinner, and who tried to be available to us for advice, it was Bill Huskins who actually took us out to the bazaars, took us out to the restaurants, took us around the city, even the rug dealers, in order to make us feel comfortable about being there. And it made all the difference in terms of me actually getting out and about and feeling comfortable about it. Next slide. As I thought about those things that were important, uh, that were perhaps a little different from what we experience here in the U.S. in military communities. Here are some of the things that did have an impact. In the embassy, our ambassador was the former head of CIA, so you can imagine we had plenty of contacts along that line. His deputy and his deputy's wife were just so gracious about introducing us down to the key people within the embassy. My informal sponsor, Bill Huskins, our best friends were a family physician who worked part-time at the hospital and part-time throughout Asia. We learned later on that he had other responsibilities in addition to being a physician that put him in a position to know a great deal about what was going on in the Middle East at the time. My own background was also, as I realized, pretty helpful. I attended University of California at Berkeley, and for a couple of years, my roommate was actually from Iran, and we were so fortunate. I learned a little bit of Farsi, but I learned a lot about the culture of Iran and how it was different from the surrounding Arab countries. Um, and so that was, an eye opener. My anthropology major and the fact that I had spent 2 years as a Vista volunteer between the time I graduated and the time I entered the Army, those were also very important parts of being able to feel comfortable in a different environment. My 2 years as a Vista volunteer were in the migrant community, farm labor community in Florida. And my second year was in the mental health system in West Virginia. And finally, the commanding general's wife, and this made all of the difference in terms of our experience, at least in retrospect, it did. And again, I'll be interested in hearing your comments about that. Okay. Fran Partain was the general's wife I'm referring to. The picture on the right side was about a year or two after she served, along with her husband, uh, Brigadier General and then Major General Edward Partain. And some of you may have remembered he was also the lieutenant general who commanded Fifth Army uh, way back when. That would have been in the late 70s or early 80s as well. I tried to get a photo of Fran during that era. I couldn't. The one on the right is the closest I got, but I was able to run across a photo of her when she was younger, and taking a look at her, you wouldn't be surprised that she was in competition for Miss Arkansas when she was younger. So the Fran Partain I knew looked a little like both of them, maybe a little bit more like the one on the right. Uh, and shortly after I arrived in country in 1974, I met and again collaborated with her, who really minimized and practically made any kind of stigma associated with mental illness absolutely disappear in our American military community. Now, that sounds like magic. So, how did that happen? Well, I regarded Fran as our guardian angel, and after familiarizing herself with our social work and mental health services, uh, Mrs. Partain convened a gathering of the spouses, all the wives of American Army unit commanders in Iran. All of the husbands were working for her husband, and she introduced me to the wives, a gathering of the wives, with the following message, and I tried to recreate her actual words. I remember her saying, "This is Captain Furukawa, who heads up our hospital's social work and mental health services. I want you to get to know him and all the services his staff has to offer, including individual therapy, couples therapy, parent-child therapy, addiction problems, and issues with living overseas. All American military members and their families will experience culture shock while in Iran. All of you. Many and maybe most of you will need to talk with him and his staff for advice on how to cope with and get through the experience so that your family has a successful assignment here. I want you to introduce him and invite him to every orientation you conduct as your families arrive. And I want you to talk with your husbands about inviting him, meaning Paul Furukawa, to every orientation they conduct with their service members. He assures me that mental health services will be confidential. If you do not need to be evacuated back to Europe or the States, your men's and family's records will be clean." That was her message. And the impact of Fran Partain's introductions changed the way our mental health services were welcomed in this overseas American military community. And here were the big changes over the 2-year period. My staff's schedules were full of invitations to speak at units and at social gatherings, as well as their counseling sessions. Clients who would have shied away from acknowledging us at work or in social settings, like here in San Antonio would be an example, were almost ebullient about greeting us in public or stopping us at the commissary or at a softball game to give us an update on easing tensions at home. In other words, they did not mind being seen with the mental health people, which was a big change from my experience here in the States.
Hey,
The
Paul, if I
wives,
might, we're getting
yes,
close to the bottom of the hour, so remind folks, I think we're going to run probably a little longer here. Paul, this is fascinating. I have quite a few questions. Also, do you want to take questions while you're going? We have one hand up right now.
let me get through this, and then it'll be easier to do the questions then.
Perfect.
Thanks, Billy.
You bet.
Yeah. Well, what's amazing is that wives welcome our advice to hire maids to control the ever-present desert dust in cleaning their very spacious Tehran homes. They took our advice to eat and shop in unfamiliar stores in their neighborhoods instead of just at the commissary and the clubs, and also to take tours to other cities in Iran. And in fact, not just in Iran, we were urging them to visit Africa, go to Russia. My late wife went to Russia, for example, for a visit, or other parts of Asia. What was also different was that unit commanders and supervising sergeants would often refer and escort soldiers, sailors, and airmen to our office for their first visits. Soldiers whose high security clearances were removed because of their presenting diagnoses, for example, maybe suicidal. They had their clearances reinstated by higher headquarters upon our recommendations. For many settings, that's unheard of to get back your top secret clearance, but upon our recommendation, this often happened. When we discussed our experiences of Fran Partain's promotion of our services with our colleagues who were in Europe and back in the States, we discovered other contrasts. In our first 2 years, we had patients whom we diagnosed as suicidal, about 24. Most likely because of our early intervention, we did not lose a single patient. In contrast, our colleagues with troops and family members in Europe said that for the same number of suicidal patients, they would have lost 5 or 6. And so, unfortunately, with the overthrow of the Shah in 1979 and the departure of the American military, we don't have records beyond recollections on the part of those of us who were there. And I'm very pleased to be able to share with you that experience as well. Good time for questions.
Looks like we have one hand up. Jochana? I'm probably saying the name extremely poorly and they don't even recognize it. We have someone with a hand up. You have a question?
Yeah, Miss Sharma.
So, Martha Ann, I noticed you posted a picture. You want to explain the picture you posted in the chat?
When you showed the pictures that looked very much like women here, I thought of the contrast of being there in 2010. I was at a wonderful academic conference, but women had to be covered. Like legally, I had to be covered to get a visa picture to get into Iran. I constantly found ordinary people, students, professors, so cordial, so kind to me. And at the same time, a government line of being, I don't know how I want to say, oppositional, being very negative. So I think all over the world, we can make friends with ordinary people. And if we can build that citizen diplomacy and whenever you're talking about mental health challenges, can we be friends who encourage each other, support each other, do positive things?
Totally agree with Sister Martha Ann. Totally agree.
Paul, did y'all have much interaction with the Iranian military, the Iranian government part?
Not with the Iranian military. Now, many of my American military colleagues did because they were instructing them on, how to fly some of the equipment, how to repair and replace some of the airplane parts. Um, and so they had a lot of experience, and the experiences were primarily positive. Um, in fact, it was, as Martha Ann pointed out, they were some of the most gracious folks I have ever run across, in my total career. Um, so when I tried to go back to visit Iran a number of years ago, I had my tickets made and everything set up, except once they found out that I had been in the American military, not just because I had been assigned there, but just because I had been in the American military, I was not allowed to go back to Iran. And I, am looking forward to the day that I could visit Tehran, Shiraz, Esfahan, and so many wonderful places.
So Paul, looks like Ms. Sharma was not able to get her audio, but she typed it in the chat. Do acceptance of mental illness trauma differ in American versus Iranians? She's a part of a South Asian domestic violence organization with victims that don't report it due to the stigma.
That's an interesting question. You know, our part-time psychiatrist was an Iranian-born and raised, but American-trained psychiatrist. And let me think. I'm trying to remember if he was able to describe some of the differences. I know one that stuck in my mind was the fact that he uh, himself was believed in some of the more mystical beliefs about being able to change things from one thing to another, to create, for example, a Jeep out of parts, and to be able to jump off a cliff and not hurt yourself, which I found, kind of fascinating. But otherwise, he was American trained and knew all of our prescriptions and was able to write the prescriptions that we needed for our patients. But I'm not sure about the answer to her question, though. Maybe someone else knows the answer.
No more questions right at this moment, Paul. So did the family members take advantage of your services in addition to the servicemen and women?
Uh, did which?
The family members of the service people?
Oh, I, again, I was absolutely amazed. Not only, were they willing to greet us in public, but they, in fact, did take our advice. They went out, very cautiously, out shopping, and when they found that to be a positive experience, they took our advice about taking tours, and we had gotten no feedback indicating any kind of problem. Now, we did recommend that they stay away from those cities that were considered ultra religious. And there are several, Mashhad and Qom were two examples. And we just advised folks they would want to stay away from there. But in the other cities, again, as Martha Ann pointed out, you wear the chador. The women did cover their heads when they went into a um, well, as in particular when they went into a mosque. And to the best of my knowledge, our American uh, military family members complied with that uh, very thoughtfully.
Any other questions for Paul? When I was working, I had large teams in India. I visited India quite often, very different from Iran. So I have no idea the comparison, but I found the interacting with local culture was fascinating. They were usually incredibly curious about Americans. The young kids would stare at my wife because her hair wasn't black. And little things like that really stood out at you.
Yes. How does that compare with our experiences here, where we might have an opportunity to say something at our workplace that would have an impact? Have any of you had some experience along that line, either positive or negative?
Somebody else, please jump in. I was at Intel, and Intel in Oregon was extremely multicultural, and the site people made a focus of celebrating events across lots of cultures. And so when various cultures would come up, the cafeteria would set out food appropriate for that culture, and it was an amazing way to go, try it, very different texture and taste, but then to ask, so what is this, and how would you eat it, and what would you're learning a tremendous amount about the cultures. So.
Absolutely. One example is that we had an American trained Iranian physician whose wife was American, and he worked here at the American hospital. And we would walk down the hallway, and he would grab my hand And so, I mean, in the U.S., at that time at least, folks would often shy away from doing something like that. But it was so common for uh, men who were friends to hold hands walking down the hallway. So I got accustomed to being uh, having folks reach out and do that and not feel so uncomfortable about it.
Any other questions for Paul? Oh, Peter.
Hey, Paul, fascinating presentation. A couple of thoughts and a connection. In our ministry, our school, our director of the school is Iranian descent. Her father was a military member in Iran, and he came to San Antonio for training. Met her mother, they married, and then it's a long story about the back and forth, but he ended up staying here. And so she shared her perspective of from her father's view. And what was fascinating about your story, and I think is key to that, the breakthrough that you got there with someone in authority like Miss Partain, being able to make the connection and introduce you. And I think in our faith-based communities and our churches, and I saw it happen in ours, where our leadership saw the value of mental wellness and addressing it and trying to break that stigma by addressing it from a spiritual perspective. And many of our churches, of course, as we say, create that stigma and we hold it. But when you get the leadership to start to make build those relationships, and I saw that's what happened there. And I think that's the model, how she introduced you and said, this is good and we need to embrace it because there's value to it. And so I appreciate the story. One is fascinating, everything considered. And just thank you so much for sharing it and appreciate the work that you've done and continue to bring value to our community even today.
Well, you're welcome, Peter. Many Iranian military were trained at not Wilford Hall, but Lackland,
Mm-hmm.
in terms of the piloting and mechanics training and so forth, and so we got a lot of feedback from folks who, in fact, had spent time here in San Antonio.
Paul, we're about out of time, but Martha Ann, looks like you shared another interesting picture.
Yeah, it was so much fun. A student artist who was doing a caricature of me as we were listening to a presentation. Paul, you were saying, do we see anything around us that goes along with what you're saying? And I've never done this before, but you're people of faith. I ask your prayers for one of our students, but it could really be prayer for students all over. She needs counseling so much, and she won't go to get it. And we have all kinds of free counseling services right here, so easy to get. And she's doing very strange, difficult things right now. And then she's bragging, I haven't gone to counseling all semester. And all I can just think of is I'm holding her in prayer. And I invite us to pray for all these young people that they will go for mental health counseling. Anyway, God be with them.
Yes, indeed. And sometimes a friend or family member who can break through in ways that the rest of us cannot, are so valuable in being able to help them make that leap. Good examples. Yeah, and we ran across a number of folks, particularly back here in the States, who had that mindset. And often, of course, unfortunately, because the American military, was not always outwardly supportive of seeking help like that.
Beverly, you have a question real quick?
No, I just wanted to just simply say, Paul, thanks again for I put in the chat that you truly uplift the spirits that you come in contact with, and your stories just remind me that you know if God wanted the difference, and particularly since I'm in the whole field of behavioral health and mental health in general, that we all need each other to get through this journey. I mean, we're all on a journey, and it is the people who are who we run into during this adventure that really help, that really do uplift our spirit. And you just reminded me, I believe that friends and people along the way are God's way of taking care of us. The people, you know, it's his way. He put everybody here to impact people for a reason, and it's his way of helping us take care of each other. And I just appreciate you. And I'm just so glad I've gotten a chance to know you over these years. So thank you for sharing.
And thank you, Beverly, and thanks, Sister Ann, for having heard the story and asking me to share it with you.
So Paul, thank you for taking the time to put together your thoughts on this. It's fascinating. You know, we always know that everybody has a background that you don't know the rest of the story on. We just learned a little bit more of your background, and thank you for being willing to open up and share the story. I don't know what the next week plan is. Ann just asked me yesterday afternoon to help host this, and so I'm thrilled to be able to give her a little bit of a break on her time off. I hope the rest of you have a great rest of your Thursday, Friday, and an awesome weekend. We will see you next week.
Thank you. Bye, everyone.